Lebanon's crippling financial crisis is having a disastrous effect on the country's healthcare system, with the drastic fuel shortage, the exodus of medical workers, and the lack of equipment and medicine. Hospitals in Lebanon are on the brink of collapsing. DW's Rebecca Ritters went inside Beirut's largest public hospital to witness the grim reality staff and patients face as they try to stay alive.
On this COVID ward, the youngest patient is just 2 months old. The nurse gives him medication through a nebulizer to help him breathe. Nervous mum watches on. For the many patients here, this overflowing ward is their only hope. This man surrounded by a dozen others, all fighting for their lives.
This is one of 2 corona wards in the hospital. This used to be the ER room. Now it hosts only corona patients. The more critical ones go upstairs to the ICU. It's already at full capacity and the numbers continue to rise.
As I'm shown into the ICU, it's clear a COVID patient has just died. Yet it's not only the disease, the staff here are fighting to keep these patients alive. The machines that help them breathe could cut out at any moment. The ventilators are powered by these generators because the hospital can't rely on intermittent power from the state-run grid. They have only 3 days of fuel left.
The fuel is a challenge. It's a challenge every day. We have challenges every day. It affects the patients, the medical equipment, the chiller, the cooling. So the fuel is the most important thing in the country is the fuel.
The problems don't stop there. The hospital's general manager tells me morale is at rock bottom.
We are seeing a lot of doctors and nurses leaving. Yesterday alone, we had 5 resignations in our nursing department, and a senior physician also who's responsible for the radiotherapy program for our cancer patients informed me that they are leaving the hospital. So, these are not easy to replace.
Over in the hospital's pharmacy, the shelves are nearly empty. The government can no longer afford to subsidise imports of medicine, and supplies are running out.
We're hanging on by a thread. I think that, it's probably a matter of time before an accident happens, and then that can result in loss of lives.
As Lebanon's economy collapses, Firas Abiad fears without drastic intervention, the healthcare system will soon collapse along with it.
And my colleague Rebecca Ritters joins me here at the big table. She just returned from Lebanon. It's good to see you, Rebecca. I guess we could say the pandemic, it added another layer to Lebanon's crises. I mean, have the doctors and the nurses who wanted to leave the country, have they done so? Is their exodus over?
I don't think you could call it over, Brent. I mean, the exodus has been ongoing for the last 2 years since the financial crisis really hit in Lebanon. It's been ongoing since then, and there's sadly a lot more to come, I would say. I mean, there have been thousands. It's hard to get a real figure on how many people have actually been leaving the country, but anecdotally, we hear of people all the time. Everyone you speak to is either preparing to leave, considering leaving. The general security, where you go to actually get your papers and get your passport. I mean, they have had to open up a whole wing of people because they have so many people there trying to just get documents. Not necessarily to definitely leave, but just they want to be prepared. So if things get worse, they will leave. So I think we'll be seeing a lot more.
And what does this mean for the growing number of hospitalizations in the country? I mean, who is taking care of the people who are getting sick?
Well, I mean, obviously, I met many doctors that were there. Obviously, there are still people staying in the country. With the conversation that I had with Firas Abiad, who was the general manager you saw in that piece, he was saying that it's really everybody's duty to stay in the country and keep fighting for that country. He was saying, what do people want? They want to leave and then come back when the country's been fixed, which is a fair point. But at the same time, these people are highly educated and they can barely make ends meet. I mean, it's no wonder they're leaving. But there are still some people willing to stay and fight.
Most of the show has been about the dire situation in Afghanistan. And Lebanon, like Afghanistan, needs foreign aid to make it to the next level. And Lebanon, like Afghanistan, has a major corruption problem. That is not going to change when this pandemic has become history, is it?
Unfortunately not. I really don't see that happening. And the corruption obviously has nothing to do with the pandemic itself. And so the pandemic, as you said earlier, was an added pressure on top of what is essentially a country in free fall, a crumbling country there. And so when the pandemic, if the pandemic is over, when it's over, the country will remain the same. And it's just an added, as I said, added pressure. People are pegging all their hopes on the upcoming elections next year, that there might be some governmental change. But I think it'll take longer than one election cycle. These people have been in charge for a really long time and they're hanging on. They really don't want to go anywhere.
You know, when we talk to our colleagues here who come from Lebanon, I mean, you can hear the desperation in how they describe what's going on back home. I mean, what was your impression? Have you seen a place that seems as desperate and at the same time seems like it shouldn't be that way?
Not personally, no, I haven't. And I've been going to Lebanon for quite a few years now, and I was really shocked this time around. I mean, I was there shortly after the blast last year, but this year it really was driven home to me just what's happening there. And people are desperate. Even the short time that I was there, the situation, I would say, doubled in its complexity. People are in a desperate situation. It's all people are talking about on the streets. It's all, every time, every person you meet, it's really, the conversation goes no further.
Rebecca Ritters, as always, Rebecca, good to have you at the big table. Thank you.